Newborn Screening Collection. The newborn screen should be collected when infants are between 24 to 48 hours of age, with a target of collection at 24 hours of age. If an infant is going to get a transfusion, the newborn screen should be collected prior to the transfusion, even if the infant is less than 24 hours old. Another screen should then be collected 48 hours later on babies who received a transfusion. Please check with your state's specific guidelines regarding a newborn screening of premature and sick infants for further clarification. Step 1. Demographics. Verify that the demographics on the newborn screening form are complete, legible, and accurate. Step 2. Supplies. Gather the necessary supplies: blood collection card, gloves, heel warmer, sterile gauze pad, sterile pediatric lancet, sterile alcohol prep. Step 3. Preparing the infant for the procedure. Verify that the infant and the blood collection card demographics match. Keep the infant warm and comfortable by swaddling. Only one leg will need to be exposed for the procedure. Letting the infant suck during the procedure can help soothe and calm the baby. If parents are present, they can assist by allowing their infant to suck their finger. Otherwise, a pacifier can be offered if parents are comfortable with this option. Assess the infant's heel for previous heel sticks that might have been performed for bilirubin or glucose checks. If the selected heel appears to have been used for other procedures, use the other heel if possible. Once the heel has been selected, identify the puncture site. Place the heel warmer over the puncture site for typically 3 to 5 minutes, or as instructed on the warming device. Using a heel warmer will increase blood flow to the site. Newborn screening collection protocols may vary. Check with your institution regarding the use of heel warmers and puncture devices. Step 4. Collection. After allowing the heel to warm, cleanse the site with alcohol prep. Allow to dry completely, as alcohol can contaminate the blood specimen. Position the foot lower than the heart to allow for good blood flow. Puncture the heel with the lancet. Wipe away the first blood drop with a sterile gauze pad. Allow another large blood drop to form. Be patient, as this may take some time. Collecting a large drop of blood is essential to ensure a sufficient quantity of blood and complete saturation of the blood through the filter paper. If you are having trouble obtaining a large drop of blood, you can try these techniques to encourage blood flow. Apply pressure, beginning at the top of the leg and working down to the heel. Gently squeeze and release the area of the foot around the puncture site. Vigorous squeezing or milking of the foot will result in serum separation. After the blood has been collected, the baby's foot should be elevated above the body and a sterile gauze pad gently pressed against the puncture site until the bleeding stops. Do not apply additional blood to a spot where blood has already been applied. This causes a layering effect. Do not apply blood to both sides of the card. Once specimen collection is complete, it's a good idea to have a designated person at your facility do a spot check. The spot checker can determine that sufficient blood has been collected to fill the circles. Determine the blood saturated through the filter paper. Ensure that each circle only contains 1 drop of blood and the blood is not layered. Ensure all the demographics on the card are accurate, complete, and legible. Air dry the collection card horizontally for only 3 to 4 hours on a dry, clean, non-absorbent surface. Horizontal drying allows for improved saturation of the filter paper. Consider using a drying rack.